we've gone over how we assess shoulder function, which is related to adhesion. If your problem gets worse with activity, better with rest, that's likely an adhesion problem. That's something that we can fix, and we can fix honestly rather quickly. But what if yours is more complex? What if you have that D word, degeneration? How do you know that's going on? Well, we use a few things to determine that. One is going to be your history. Does it get better with activity? And maybe you're sore in the morning, or after activity we got some throbbing? That's a sign of degeneration. Do you have lots of clicking and popping when you're moving your shoulder around? Or there's certain positions that give you really sharp, intense pain? That's a sign of damage. Now, when we try to figure out exactly what is damaged, we do a couple tests. One is we'll assess to see, is it a labral tear, right? Or is the labrum involved? The labrum is a cup that surrounds the joint. It's kind of like your training wheel, so the joint doesn't dislocate. And it just so happens that at the top of that labrum, in that joint capsule, is where your bicep tendon is. Now, when it comes to the bicep, one of the heads, the bicep, so there's two muscles that combine to one tendon. One starts on the labrum, one starts up here in your scapula, and they both come down here to the thumb side of your elbow on your radial head. So what ends up happening when you do this test, you go thumb out and down, we put pressure, or we put tension on the bicep, particularly the one that's connected to that labrum. And if we resist, the contraction of that bicep will pull on the labrum. And if there's a labral issue, or even if there's lots of adhesion in the bicep, you're going to get some shoulder pain. So a lot of what we do is, can we take pressure off of the degeneration? Because honestly, if your problem is both, if we, just by removing the adhesion, we can turn a lot of those degeneration type symptoms into much milder or even non-factors. You know, if we take enough pressure off of the bulging disc, we can actually get that bulge to go away. The little tears in the annular rings in the disc will still be there, so it'll be easier for that bulge to reoccur with bad habits. But we can take that pressure off, and by doing the right things, you can have a reduction in symptoms. This is what we're looking for in the shoulder. So if you have lots of clicking, that's telling us there's likely some damage in there. The damage doesn't have to cause shoulder pain. For instance, I have some labral damage in here, in front, right? I can do a bench press, no problem. I can go overhead, no problem. If I do an incline press in about 5 minutes, it'll feel like my shoulder is just throbbing because I'm going into that little bit of degeneration in the labrum, and that's creating a bunch of inflammation. So then it's going to kind of throb for an hour or two, and then it's going to be better. So it's in my best interest to stay out of that range and do other things that aren't an incline press. Go overhead press, do bench, do some overhead cleans or whatever. I can still build strength, but in that plane, I should try to limit the time spent there. Sometimes you really just need to, have a little reality check and say, this is the reality I'm dealt with, and this is how it's going to be. How can I age gracefully from here? So you have to look at your history. You have to kind of look at when you're getting these symptoms and what's causing them. The most common is that labral tear. Sometimes just cartilage damage is this little snap, crackle, pop when you go in there. But outside of that, like a torn rotator cuff is going to get worse with activity. It's going to throb afterwards. You're going to have trouble catching your arm. If somebody were to hold your arm up here and then drop it, if you catch it, it'll also have a sharp pain. That's a sign of rotator cuff damage. So there we have it. You've got a little more knowledge when it comes to that shoulder degeneration. So use that knowledge. Reach out to us if you have any questions. Thanks for watching.